Hi, I'm Molly Sullivan with Tennis MD, your source for all your tennis health, fitness, and injury information. Tennis players typically don't get clavicle fractures, but they can occur from a fall or direct hit to the clavicle. The pain and injury will cause tennis players limited mobility and misplay. Today we visit Dr. Michael Meow, sports medicine orthopedic surgeon, to tell us more about clavicle fractures.
A clavicle fracture is a break of the collarbone. Usually those occur when you've fallen directly on your shoulder, usually after a trip or a fall. The symptoms of a clavicle fracture are pain, sometimes swelling enough that you see bruising around the actual fracture site. The treatment for clavicle fractures depends on the degree of the injury. For a minor break where the ends are not displaced or put apart from each other, we usually have the athlete wear a sling until enough healing has occurred that we can start motion and physical therapy. If the fracture is significantly displaced or the ends are farther apart, that might need surgery where you would put either a pin or a metal plate with screws to hold the pieces together until it heals. An athlete can play with a problem depending on the degree of injury. If there is a minor break and there is sufficient time to heal in the first month or so, a non-contact athlete might have the chance to return to play. Contact athletes, however, need full healing of the bone before they return to sport.
The rehabilitation is difficult because it's just this little bone that connects the shoulder to the sternum, right? There's no primary movers of that bone, so really the main rehabilitation has to be to rehabilitate the entire shoulder, which means strengthening of those muscle groups around the shoulder, making sure the range of motion is achieved. Because again, most of the time with clavicle fractures, you're going to be immobilized like this for 3 or 4 weeks, which then creates stiffness in the shoulder. So we need to really get rid of that. And that's going to take at least 4 to 6 weeks, professional or amateur. It's just going to take 4 to 6 weeks. Bone time to heal, and then get them back rehabilitation-wise to have a strong shoulder and prevent any problems.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with TennisMD.com. Remember, at TennisMD, health equals performance.